And welcome back to Carolina and Company Live. All right, now, this is something you need to listen to because we're talking about skin cancer and things like that that'll affect you. And if you live along the Grand Strand, a lot of us go out in the sun.
That's right. We've got Dr. Epperson with us today. He is back. We also have Dr. Frankie with us. And we're going to talk a little bit about skin cancer and exactly what you all do. Dr. Frankie, tell us a little bit about your practice, what you do.
Well, at Carolina Regional Cancer Center, we treat all cancers. Lung cancer, breast cancer, prostate cancer, those are more common cancers, but we also treat a fair amount of skin cancer. And skin cancer is the most common cancer in this country. And it stems from most people going out in the sun. And basal cell and squamous cell skin cancers are the most common.
Okay, and obviously living at the beach, this is, you know, it's an issue everywhere, but at the beach it's even more magnified. I feel like Dr. Epperson, tell us a little bit about
Well, certainly there's far more cancer in those who have been exposed to the sun and of Northern European heritage. The big point about it is if you have a lesion, you don't know what it is, we certainly can evaluate it. Dr. Frankie is here today because there are times where lesions are in places, especially on the face, and it can be horribly disfiguring to have cancer surgery done on the face. And this surgery can be done actually not having to do surgery. You can do it with radiation. This particular case right here shows a nose of a patient that's treated with radiation that had cancer that could have been a very disfiguring cancer, but obviously they've had a very good result.
And that is true, actually. My grandfather had it on his nose, and they've cut away a lot of his face, and it is disfiguring. Dr. Frankie, tell us what you do.
It seems a little ironic, but ultraviolet radiation causes skin cancer, but X-ray radiation can take it away.
Interesting.
And the radiation therapy is actually as effective as surgery for basal cell and squamous cell skin cancers, and it does give an excellent cosmetic result.
Now, there's a number up there right now if anybody would like to call, find out more about what we're talking about.
Yeah, absolutely.
And I want to know what that is.
Yes, what is this?
This is called a Leipzig applicator. It was developed in Leipzig, Germany, but it allows us to give radiation therapy directly to the surface. And so,
Here, let's hold it up for the camera right there. Let them see it, okay?
What you can't see is how heavy it is.
It is, right.
It's shielded, and the only radiation comes out right here. This is a hollow catheter, and a radioactive tip cable slides in place for just a minute or so. So the patient doesn't feel anything with the treatment. They're there just for 2 minutes, and they get up and they go home. And we can do the treatments in as few as 6 treatments.
Wow, that's
all
pretty
right, now,
fantastic.
anybody need to get in touch with you, there's the phone number. Anybody want to find out more about this, because this is something you don't play around with.
Yeah,
you know, I'm
absolutely.
talking to both of you, right, Doc?
That's right. If it's a pigmented lesion, of course, we don't treat those with radiation, but the more common is the squamous cell and the basal cell, and those that are disfiguring, we can treat those with radiation if they're going to be special surgery in the face.
Thank you
We
both for
appreciate
being with
it.
us.
Thank you.
Very
We
informative.
appreciate it.
Thank you.
All right, you have the number up there. If you want to know more about this, give them a call and you can find out more about it. We got a lot more coming up. Don't go away. We'll be right back.